Hi, this is Anna and Dr. Richards. I'm back again with you. Dr. Richards, thank you so much for agreeing to do another segment with us.
Of course.
So in an earlier video, we talked about patient-centered care and kind of what to expect with that model for the clinic. And I kind of wanted to follow up with you and get a quick sense of really how that plays out and how we practice medicine here at the Natural Rejuvenation Center. Could you kind of fill in that gap for patients for me?
Yes, I sure can. Here at the Natural Rejuvenation Center, we operate under a set of principles that we hold very close. The first one is not causing any harm to the patient. That's very important. We don't want to sit here and just prescribe you medications and then, we'll end up prescribing another medication to deal with the side effects of the first one, and it can be an endless cycle. So the first thing is we don't want to do anything to cause you harm. So we want to essentially use the least invasive techniques or treatments that are still going to be effective for you. Other principles, the next one that's very important is kind of, we believe that if the situation is ideal, if the nutrition, your diet, everything is working like it should, that your body is going to be able to regenerate, it's going to be able to heal, it's going to be able to fight off whatever infection or whatever might be going on. So sometimes you just need a little bit of help to get that process going. Another important principle that we have is treating the cause. Treating the cause is very important. Rather than masking symptoms, just addressing the symptoms, we want to look a little further and figure out what's originally causing these different things to go wrong. Another thing that is very important is individualizing the treatments. As we went into in the last video, every person is an individual. Everybody has different needs. Everybody's going to respond differently. So we want to take the time to get to know the individual patient. That way we can individualize the treatment plan that'll be most successful for them, essentially. The next principle that's very important is prevention. Patient education is so important. There's so many things that we can do to prevent different illnesses from occurring in the first place. We want to work with you on, diet, nutrition, spinal alignment, just different areas, counseling, mental health. There's so many different areas that we can cover to kind of encourage the immune system to function as ideally as it's supposed to. And that will hopefully prevent these different conditions from manifesting in the first place.
Right. And I know that another thing we like to do here is really give custom education to the patient. Whereas in a lot of places you'll get like handouts that aren't very custom to what's going on with you for a care plan. So how do we make sure here that we're providing custom education for our patients?
It's all about taking the time to talk to you. We are not just going to hand you a piece of paper and send you out the door. We don't have pre-printed treatment plans. We are going to create that during the patient visit. We're going to be very thorough in making sure that you have all the different pieces that you need in order to continue the treatment plan at home. Because the treatment you get in the office is just the beginning. What really is important is what you do at home after you leave the office. It's very important.
That's great. Well, thank you so much for your time here again today. I look forward to continuing to help educate patients on how they can become healthier for themselves and for their families. Thank you so much, Dr. Richards.
Thank you.